We will be back here every day, and I'm feeling kind of a long stream today, so get ready. We will, cool. Got all our mics hooked up. Obviously, as people come in, give me a little thumbs up or down if you can hear me well. But pretty standard day, I would say so far. Just kind of doing a mix of background things, talking with patients, doing all the stuff. But had some time, so figured, why not jump on here? Say hello to the people. Which kind of quiet for, I don't even know, what is it? Tuesday, right? Tuesday. Freezing in this room, especially by the window, but the cool snow was like, had to keep it in. I mean, look at that. See it on both cameras. The snow covered trees. We've actually had a decent amount of snow here in New Jersey for, I don't know, the past couple days at least. It's kind of shocking to see this. I think we got 8 inches of snow, and then we're supposed to get more. So finally, a true winter here in New Jersey. But yeah, man, popping in. How we doing? I actually switch to the comment chat just because it's way easier to see what's going on here. What's going on, people? I see some familiar faces in here, or names. I guess it would be kind of cool if it was just a big Zoom call instead of just a bunch of names. But Miss Lori, hey Antonio, long time. But I found out I have methane SIBO. Oh man, still supporting the upper GI here. Still want to be doing good stomach acid support, B10HCl. I also like Oregon grape. I also like dandelion root. But I would wonder if that was just a breath test because that won't show you now. Okay, cool. How do we fix it though? When it comes to fixing that, you do need to do a functional GI test because it will show you, okay, what are the different pieces that we need to put together so that we can build that GI tract back so that this doesn't happen again. But whether it be antibiotic use or just crazy immune battles that are going on, okay, breath test and a GI map. I would like to see the GI map, especially if it was pretty recent. Um, Obviously, from a holistic point of view, I can give you a good direction as to what to be doing there in terms of certain microbials that are showing up and what that means in regard to food practices too. But beyond the information piece, it's now how do we get you back to a good state to where you're not bloating like crazy after meals or have crazy transit times. So GI map only showed fusiform. Okay. Very low beneficial. So you probably had a decent amount of antibiotic use up until this point, even if it was when you were younger. But yeah, I mean, nothing wrong with getting soluble and insoluble fibers up. Dropping sugar is always going to help. I wouldn't want to be too aggressive with you, but in the past, yeah. Well, hey, send me a message. I'll give you my email, and you can send me the lab and figure out what we got to do. Chamois, popping. I don't think I've seen you in here before, Chamois. So hey, how's it going? Nas popping in before the craziness over on YouTube. It's gonna get crazy. Always in the YouTube chats for some reason. Kind of wild, especially last night. Last night and the couple previous ones have been just brain rot in the chats. TikTok questions are phenomenal. So keep going for you guys. I have a secondary phone right next to you. So that's why I came in early. Yeah, I guess if it's before or after dark, we will get some normal people in here. I sure freaking hope so. We'll see though. We just started. We're less than 5 minutes in here. Bum. Okay, more details from Lori. So now take in antimicrobial meds for the SIBO, then hop into supplementation afterwards. Very nice. I heard probiotics are horrible for SIBO. Yeah, you don't want to. You're in a weird spot because the large intestine is very low in beneficial bacteria, but the SIBO story up above, do not put probiotics on that. You're gonna blow like crazy and pretty much get the same piece of what's been going on. But yeah, that's true. At least until you can start to correct these things. So Colin popping in here. See the snow on the trees, which I'm sure you just dying to see down there in Florida. What's up there, Doc? Shami, anxiety killing you? Well, what have you tried? In terms of the best labs out there for something like anxiety and getting to the root of these things, the GI does play a huge role in this. So just to kind of lay that framework down, because it does come down to inflammatory levels. It does come down to opportunistic infections and kind of what Lori was mentioning earlier. Because your stinking GI makes all of your neurotransmitters. Not all of them, but 90% of them. So it's a great place to start looking. And that's really pulling away the inflammatory foods that start to create these issues. But again, mental stress is going to mess with the GI too. So you need a good starting point. I like pairing California poppy with ashwagandha, just not really knowing much about you at all. If you have a certain response that's going on, maybe more norepinephrine and some of the catecholamines, and just having trouble converting those out. Maybe Kava, St. John's, a little bit better of a duo there. I'd also wonder about some fatigue going on and what the rest of the story is, but we may do something like Dutch. And depending on the budget and things there, maybe we just do things through blood work and do a smaller panel, but it's kind of where you got to meet everybody where they're at, you know? Um, but the Dutch test is a beast when it comes to figuring out a hormonal or a adrenal issue, especially because you get all of that mapped out. You get a circadian rhythm map. You know the free cortisol amounts that are circulating, which is what your body is using. And then you know the total amounts throughout the entire day. It's a urine test, so you do it a couple times a day. You do need a provider to order that for you. But yeah, I'd be curious as to what you've tried so far. At least doing some liquid herbs in the meantime will help the neurotransmitters. Liquid herbs, that is. Very big difference there. No wonder the probiotic made me bloat, but my hope is to get rid of the methane, SIBO, and then increase probiotics later on. Yeah, you're you're going to be really wanting to focus on the upper GI right now, keeping stress down, keeping toxicity out of the system. And I would wonder if blood work was paired with that and just seeing vitamin D and a lot of the sugar based markers and things that you could easily see through some of the fog with and know what to support in terms of a rebuilding aspect there too, because you can't just get inflammation down and focus on one system. It's everything ties in together. So um, you definitely want to be careful with certain veggies, maybe even broccoli, cauliflower, and Brussels sprouts may flare you up a little bit more, just from certain microbial breakdown that needs to take place. If you do really, really love those foods, maybe try them pickled or even fermented, just to break down some of that anti-nutrient layer, and you should be okay with that. But again, I haven't seen your lab, so could be far worse than what you're putting out on here. But yes, stomach acid, stimulation of the gallbladder. Make sure you're doing some good liquid herbs there to just help out the small intestine itself. Like I said, with dandelion root, Oregon grape, um, maybe do a little bit of chamomile, but I'm not sure how hard to hit the gas until I see more info on you. But hello, Tweety. Oh my goodness. Stop scrolling. Chats like to scroll for me. It's very annoying. I have a question for you. However, do I have to follow a very strict low FODMAP for SIBO to cure it? The dietary things alone, that's going to take a long time. That's going to take a long time. Are there good supplementation that you could be doing on top of that too, just for stress reduction? Yes. Um, do you have to follow that low FODMAP? Yeah, I would totally be following that as long as you can. Obviously, you're not going to be perfect, but you really want to try. Oh my goodness, troublemakers are back in here. Okay, my daughter will not eat lunch when I get out of work at 10:30. She is so tired by 11. Any suggestions? Mm, I would say let her take a nap, and then she would be hungry after that. She's probably needing some rest there. How do I increase HDL? Exercise, best form. Omega 3s, second best form. It's 33. Woof. Yes, you need that way above 40. You need that at least 60. So, at least. My levels are 98, and apparently it's supposed to be less than 10. Woohoo! My goodness. What specialty do you do? I practice health restoration, so all natural health things, holistic point of view, but really it's rebuilding the house instead of just spraying it down with a hose every day or an axe or a hose. Not that I'm against the medical system. Medicine's great at providing life altering care. When you have a fire, when the house is on fire and your body's the house, call 911, right? Heart attack, stroke, broken arm, anything. Anything to do with emergencies. Health, though, and healthcare is it once you get a gallbladder removed, are you healthy? Because you just lost a vital sensory organ for bile secretion and all those things. So health is how well your body's functioning. If you're still having symptoms and all those things after decades of going to all these docs and specialists, there's another layer here that, and it's kind of a good thing because you don't have pathology, which is great. And that's usually the case. People are in the gray area between normal and a disease, and they're just kind of getting the runaround, don't know what to do, or you're already to that disease realm already, and now you're looking of what else can I do as the patient to get this back to normal, and there's plenty. Like I was talking about functionality earlier, testing homeostasis or your body's ability to adapt, and reducing mental, chemical, physical stressors that throw off the entire system, create an inflammatory response. Those inflammatory responses leave you deficient in key essential nutrients, minerals, whatever, and can create some toxicity there from trying to get certain things out of the body. So, like for Lori here, there was probably some sugar abuse, there was probably some low vitamin D, probably some stressing out that led to stomach acid getting too low, and then microbials that just multiplied in the GI. Plus, we know the antibiotic history. Like those are all stressors that added up over years, and now led to a situation. So, how do we peel back the layers of the onion, or be a carpenter for the home and rebuild it from the inside out? Um, you know, Health restoration. That's literally what I do. So, no medications or surgeries that I leave to medicine to do because they're great at it. And that's a huge asset, especially when you're, in a scary situation, right? Um, but let me get back to We had a couple more come in. Best foods for the gut. I like medicinal mushrooms. I like chaga. I like reishi because those, I know they're medicinal mushrooms, but they're technically a food, just a concentrated form of that. So it's kind of hard to ignore 'em. But avocados, crazy dominant, and organ meats. Organ meats, fantastic. Sprouted veggies. Um, and that's just because you're getting key essential enzymes, minerals, cofactors that help your body do what it does every day. So, yeah, I mean, don't discount fiber. Don't discount fermented foods, except for Lori. She's the only one not allowed to do that. But and for the YouTube chats, it's a health question and answer. So if they're just kind of random comments here, I'm just gonna skip right over them. Okay. Can you heal gallstones and sludge with removal? What does that mean? Does that mean? Oh no. Why is it trying to do things here? Okay, they rephrased. Can you heal gallstones and sludge without a gallbladder removal? Okay, cool. Um, I've seen that happen a couple times. It's there's not one single thing that you can do. It is a combination of a lot of things. Getting inflammation down, looking at liver health, looking at the GI, and then over the course of several months, if not a year, your body will get rid of the toxic elements. It can break down the bile and help that be less of a sludge, more of a, and you want to think of that as like liver congestion almost, or slowing down. And that's kind of what leads to stone formation in the first place, and not having enough uh, things to emulsify those fats. So it's kind of underproduction and too much toxicity, too much sugar coming to the system. Organs slow down from those stressors, they lose some function. So hopefully putting a full loop here. Boy says, yes, low vitamin D, stress. I ate so much sugar. Okay, I also have celiac, so that's working against you too. Obviously, to avoid the big key ones, wheat. I would also throw in dairy. I would throw in soy, processed sugars. I would throw in seed oils. I would throw in a whole lot. Your vitamin D should at least be like 85, 90 because of the autoimmunity. Bum, bum, bum. And then we got to do not just the vitamin D piece, but other things to get um, T cells to calm down with this crazy response. Because usually T helper cells are getting um, way too aggressive in something like autoimmunity. Now you start figuring out the autoimmune triggers to that, start pulling those away. Food is a huge one. You can do food allergy testing. Um, again, with that stomach acid promotion too, because you're sterilizing antigens that are tagging along with that food. So creating less of a reaction later on within the GI. Short chain fatty acids, massive in terms of a condition like that, and really anybody's GI, but especially soluble and insoluble fibers. And I probably wouldn't go too far into that because of the SIBO story. So you have a lot on your plate at this point. Um, get inflammation down though. Albizia, chamomile, Oregon grape, things like that, just to help correct some of the microbials and things, and then get the vitamin D to correct. I would want to see A1C. I would want to see insulin. I would want to see triglycerides. Um, I wouldn't hurt knowing neutrophils, lymphocytes. I would wonder if you were anemic. That's really common to see, just for the lack of absorption there. Maybe some magnesium citrate, but we're kind of shooting in the dark here until I see some labs. So, Lori, send me a message. We'll do an intro call for free for you. Mods, this is super helpful. Thank you. You are welcome. Thanks for joining. I don't know how you knew. Well, I have many people that have experienced the same thing as you. Well, different variations. Nobody's the exact same. I wish it were that way because it would make my job a whole lot easier. um, but it's kind of like being detectives and uncovering stones that we find along the way. So it's not a healing is not linear. J Manor, yo doc, I got a question. I have been urinating slow, prostate's fine. Been on antibiotics for 14 to 28 days, still urinating slow. What do you think the problem is? I would look into if that antibiotic has anything to do with diuretics or being something that's going to dehydrate you. I would first question hydration, number one. Um, Second question would probably be exercise because to strengthen that pelvic wall, and you do have to have some. This is getting. I'm trying to be not so graphic here. um, there is something to the muscle within males' genitalia area that it should be strong enough to shoot, a decent distance, for lack of a better term. Really trying to keep it PG, dancing around some terms here, but hopefully you get what I'm framing up there, for one thing. And two, yeah, with the hydration piece, with activity wise, that's what's gonna coordinate and strengthen those things too. So people that ride bikes a lot will typically have um, one better bowel or bladder control and excretion too. Like towards the end of emptying out your bladder, you shouldn't have remnants still feeling like you haven't peed enough yet, if the hydration piece is good and you are active, I would really watch sugars because that will affect prostate health more than anything. I would be curious of DHT and if that's starting to elevate even prior to PSA getting elevated, because PSA is pretty trash marker there. Um, could it be an infection? I wouldn't. That wouldn't be my first move, because you would have to see something off with the urine, discoloration, or something like that. I don't think. I'd be curious about burning, stuff like that. But a urine analysis is very cheap thing to do. But what other labs other than a PSA check have you had done? I would be curious of that. What else did they look at? Sent you're awesome. 10 you're awesomes. Look at that. Where are we at in terms of the follower count? Because at 1,000, I could put the self registration link and all my discounted stuff in the bio. So, mm, so why is TikTok not letting me? Okay, there we go. Sorry, frustrations. My daughter had tubes in her ears. I forget where we even left off, right? Tweety? Okay, cool. Um, but Jay Manor put some more details in there. My daughter had tubes in her ears. How can I tell if she has an ear infection versus teething pain? You would have to look in there with us very specific tools that you probably don't have. I would go to EENT and see what they could see in there. Because it's really common to see recurring infections with the tubes, but my sister had those, so saw a fair amount of that when she was young versus the teething pain. Yeah, I think we talked about the frozen blueberry trick that you could do. See how that changes or doesn't change anything. But I would get it checked out at the very least. Are seed oils cold pressed okay? Mm, certain ones. Obviously, coconut, olive. avocado. Those are really the main trustworthy ones. Lori, I am very anemic, and then I'm going to tie this into this one. I also always had low vitamin D, but if you can recommend the top vitamins for me, what would they be? Yeah, so really common question is I have said condition. What do I do in terms of the natural health stuff? And that is the worst framework of thinking to have. And TikTok, I can't blame you guys for it because it's how everybody's programmed. But you're all different. You're all massively different. If we run a food allergy test on every single one of you, we're going to get crazy different combinations of foods. So it's what is your immune system reacting to? What is your nervous system? What is your GI reacting to? Even the stress story, the vitamin D amounts. You're autoimmune, so you're going to need higher doses of vitamin D3. I want to see that paired with K2. I want to see good mucosal membrane protection there. Things like aloe vera, things like chamomile. But it's very quick or very easy to just start rattling things off. And then you go and buy a powder form of chamomile, and it has like 5% of the strength that the liquid form does. And you say, what? Chamomile didn't work for me. Or you try a bundle of a detox thing or a ton of just one thing, and it's there's no cure. There's no one cure that's gonna just fix everything. And that's not me being mean. Again, that is not me being mean. I'm just going to tell you straight up what needs to happen. And it's a matter of figuring out through labs, mental, chemical, physical stress, getting inflammation down, doing the rebuilding work, and then retesting later on, making sure everything goes away so that you can discontinue care. That is the goal. So, you know, um, at the very least, checking vitamin D, stomach acid, reducing sugars. Be very careful with the fiber just for right now. Um, but yeah, for Lori, send me a message. We'll do a free call and help you out, give you good direction. Yeah. You look like Evan Peters. I knew that was going to happen at some point. Somebody always says it. Somebody always says it. So, Nakshin, kudos to you. You were the one. Aaron, haters are okay. Haters are welcome. Cairo, stay in your lane as I talk about food. As I have more training on food than any MD. So it's like, dude, you have 6 followers, you know? And have no idea what you're talking about. The mental, chemical, physical stress is what outlines my profession. You could slam your big toe on a coffee table and your heart rate's going to change. Digestion's going to change. Hormones are going to change. Immune system's going to change. All you did was stub your toe. That's a physical stress creating chemical and mental changes. Oh my goodness. I mean, do I sound crazy or does that make complete sense to everybody? I guess throw some ones in the chat if you agree. Back to J Moner. Thanks, Doc. I have subscribed. Hopefully, get it sorted as soon as I'm a 28-year-old man urinating like a 7 or 8-year-old. Um, maybe some reishi mushroom there, and I would be curious if you're seeing some baldness starting because there's a lot of connections between the prostate and male pattern baldness because of the DHT hormone I was talking about earlier. So let us know if you see some of that changing. Hello, Doc from Penny. Ooh, we got somebody all the way across the pond there. Are you doctor? Yes. Tell me, I have a tremor in my right hand, and I have this vision loss in the control lateral eye and then sin in parentheses. Hmm. I mean, this can be a hell of a lot going on. This can be, I think of the brain initially, and the GI. I would want you to start doing some liver glandulars so you can get a lot more vitamin A. just to help with vision there. And in terms of the tremor piece, let's do some kava, just to get rid of some norepinephrine. So, very excitatory hormone. But this could easily be excess sugars. This could easily be dopamine depletion, things like that. So, it's going to vary. But in YouTube, you can go to my page and click my link and send me an email and send me more details too. Because if you have labs and stuff, I want to see them. She loved the frozen berries. That's beautiful. My daughter is 1. Not walking yet, but crawling. Anything I can do to help her walk? You don't want to push that. You want to take your time with that. Bro, you need to do a neuro exam. You want me to do that through this phone here? That needs to be done in person, my friend. So go in and get that done instead of trying to do a gotcha moment, right? Thought you were Matt Rempe at first. Skylar, that is a brand new one. I've heard Evan Peters. I've heard, um, what was the other one? There was another new one. I forget what it was. But Matt Rempe, that is a new one. I wish you guys could like submit photos in here. A lot of the stuff you said needs to do in person. Sure. Cool. Oh, I'm sorry. What did I just do here? How do I get that message back? Okay, cool. I accidentally deleted a message. He is an NHL player. What team? What team? Because if it's the New Jersey Devils, I'm going to be weirded out. Who's Evan Peters? Can somebody fill in Tweety? Because I don't want to get this wrong. Isn't it from, wasn't there a show? It's called Show You? Is that what it is? I don't speak Spanish, so I don't know. Shelly. Oh, wow. Does that actually translate? Okay, no. That's Shelly's a different one. What is this? Voice now, something, something. I don't know. Um, I don't know Spanish, so sure do it through the phone. NHL player, we got that. New York Rangers. Close enough, eh? Close enough. It should translate, she says. I don't know. But either way, Shelly asks a question. Psoriatic arthritis, extreme fatigue. Yeah, you have an autoimmune issue and it's inflaming the joints, itis, inflammation, arthro, joint. And at least in terms of practical things to do that are going to change the behavior of these immune responses, it is dramatically changing your food and running a GI test because there's opportunistic infections in there. We need to know in terms of the bacteria, the gram-negative bacteria, is this parasitology we're dealing with, and how to rebuild that system back because you're going to keep having things slip through the GI interacting with the bloodstream, and now your immune system is going to attack that like crazy for Miss Shelley here. So, initial steps, can you do some Albizia in there? Can you do some chamomile? Sure. Actually, even Oregon grape shown to help with some psoriatic symptomatology there. But in terms of fixing what is happening inside and creating this response affecting the skin barriers, you have to look to the GI and the immune system or immune response. So I would want to run at least 2 labs on you, but send me a message. We'll jump on a call and figure things out here. Skylar. Okay, more info on. Oh, he was in America. He was in America Horror Story, not the show You. So my apologies there for Miss Skylar. That's my bad. It to translate, but it didn't. It did not translate. Sandy Jackson. I'm on keto for a year and I feel great. I still can't feel full ever, even with more fiber. Really? I would want to probe a couple questions about the gallbladder here. I would want to know the transit time in the GI. Are you eating things and then having to go to the bathroom right away? In terms of how much proteins you're getting in the entire day, we need to know that. We need to know what's the total, not just protein number, but even caloric intake would be nice to know too. Um, but feel free to give us more deets. TikTok does translate. I guess it's not mine. Do I know anything about runner's knee? I've had it for 2 months. I mean, a lot of the time, this is kind of a jam-packed one too, because it can be simply doing too much. Um, the angle of the road as well. If you're running outside, the road is curved. So the right knee, if you're running on the right side of the road and you're in the US, assuming, then yeah, you're going to have an imbalance there and that will develop into muscle imbalances that will start to change the skeleton and how joints are sliding and gliding and rotating on things. So I would change the surface. I would change the shoes there as well. Try and go more, depending on the arch though. If you have a really rigid arch, it's going to really suck to have barefoot shoes, but those are your best bet in terms of overall best running shoe. Um, there can be some pelvic imbalances there too. Really, really common, especially with um, pelvic torsion, which basically everybody has. That can change a functional leg length a little bit, put some extra strain on the lateral condyle of the knee or right behind the kneecap. But can you benefit from doing some bone broth proteins? Definitely. I mean, at least get some great constituents in there to help rebuild certain aspects of the bone there. But yeah, is there a reason why my doc is rejecting my repeat of sertraline? I don't know, actually. I don't prescribe meds. I'm all natural health stuff here. Everything holistic. Um, basically, that whole realm, along with all the labs and everything. So, hello, Oz, and the nice view. I know we got the snow on the trees, right? Pretty cool. My ferritin is 214. Whoa. Holy moly. Kelly, we need to speak on the phone. You need to at least start doing some milk thistle. Okay. Who is this guy just putting letters in the chat? Freaking get out of here. Enough. All right, back to where we were. Blocked him. I don't know. Ferritin 214. You got to do some milk thistle. You're not getting rid of the storage form of iron. Common to see. I would wonder about birth control use. I would wonder about um, med history. I would wonder with how the GI is doing. I'm glad that the rest of the anemia panel is looking okay, but we got to help your liver out a ton. Um, and I want to see the rest of that lab. I hate just knowing one marker because there's functional ranges, and just because you're not outside of the gigantic range that is on the lab doesn't mean that there's not an issue starting to happen. So for Kelly, send me a message. At least start doing some milk thistle. Do not get an encapsulated form of it. We want liquid. My legs are huge, similar to edema, but it's mostly because of fast weight gain. Yeah, that's totally possible. I would cut your sugar for at least 2 weeks because carbohydrates, eating a bunch of carbs, is just going to have you hold on to water a ton. Um, I'll be doing some potassium citrate so that you can move some water outside of the cells. Maybe doing, depending on blood pressure, heart rate, things like that, doing some sauna. Could benefit from that. Obviously, exercising is going to help too, but Yeah. Um, Possible inversion tables, things like that. And then Miss Sandy. Okay. And then we'll jump back to YouTube. Either way, this was part of, I think, the keto question and asked about gallbladder. And then she says, no gallbladder. That's why you're hungry all the time. You got to do some gallbladder complex. If you don't know what that is, send me a message. I'll help you out. It's something that you have to do for the rest of your life now because you don't have that organ anymore. There is no gallbladder functioning as a sensory organ to tell your body to release bile. You're still making it, which is great. It's just now communicating with the liver when to be secreting and in proper amounts. So, yes, we need to help you out there because then you can't emulsify your fats and break them down. So, you'll see hormonal changes, you'll see changes with maybe even brain fog or joint pain because of the reduction in fatty acid breakdown. But great details there. Bathroom every other day. Woohoo. Um, yeah, I would start at the gallbladder complex um, and go from there. But send me a message. We'll talk it over more. We are so back. It's not getting old. It's funny. I appreciate it. I appreciate the OG view as all right. Where are we? I'm from Belgium, so we know snow. I'm sure you guys do. I actually just ordered a sauna from Finland. It's a non-toxic, non-off-gassing sauna. It's a sauna tent, so cheap version of it. Little wood stove and everything. I'm super excited for it to show up, but I freaking bought it as they went out of stock, so I'm pissed. And that just reminded me of it because I want to be in the sauna when there's a bunch of freaking snow on the ground. It's got a 360 view, comes with a cold plunge. Freaking thing's awesome. All right, enough about me, huh? Hi, how am I? I'm doing pretty good. What am I talking about? A bunch of health questions from a holistic point of view. Do I talk about alcohol? Certainly. All the freaking time. It's terrible. Terrible for you. Finland is more cold than us. It certainly is. It certainly is. Okay. Chosen seven. I think you're next in line here. Let me go back to here. Thank you guys for the follows. Look at this. We are getting to 1,000 followers. I don't care if I have to do freaking 3 hours on here. We're almost there. How do I check this too? Can I check this? Do you guys know how many followers I have currently? Where do I see this? Um, do we know? Who cares? Let me know in the chats. You guys do it. I want to keep going here. Chosen seven. How does a bone broth fast help esophagitis? Yeah, and I don't know if I think I covered this last time, but you're basically allowing 3 days for the entire GI lining to repair itself. So usually going to be stress induced, alcohol, smoking, obviously, food allergies, really common stuff. Is that the only way to get there? No, it's the fastest way, the fastest, most cost effective way. In terms of, rebuilding that back to normal, I would want to know a full history on you and previous labs you've had too. So, um, but yeah, send me a message, Miss Chosen Seven or Mister. My feet basically go numb, and hands been cutting the sugar though. Great. Let's throw in. I don't want to say like isolated vitamins, but get a good B vitamin complex. Ours is Wellness B complex, um, because you have B6, you got B12, you got B9, all the major B vitamins in there, which help the nerve endings a ton. Um, and you'll see a very fast reduction there. I wouldn't, maybe even some Neo 40, the professional grade, so that you can get a ton of nitric oxide to be produced in vasodilation. This is again, not to mention the sauna again, but in terms of vasodilation, sauna is your best bet. I would be going to a chiropractor as well, so that they can focus on from a arthro point of view or a joint point of view, along with nervous system involvement there, just helping the nerves fire as good as you can. It can be vascular, it can be neurological, so you kind of got to figure out which one it is. But feel free to put more details in there too. Um, I like gymnema in here. I like Oregon grape in there too, just to help the mitochondria with glucose metabolism and beta cells of the pancreas, secretion of insulin, and helping your body get that glucose stored away and out of this free circulating bloodstream for one thing, and then making its way out of the body. I used to be able to fast for longer, but since the esophagitis caused some nervous system sensitivity, probably from some deficiencies there, I haven't been able to go as long without feeling really off. But that was a water fast. So there's probably some mineral deficiencies there because you're trying to avoid a lot of foods. It's really painful. Totally understand that. That makes perfect logical sense. I would too. Um, and maybe you can do some bone broth protein with a digestive glandular for really the upper GI there and covering those deficiencies. And then probably the slippery elm and the chamomile we talked about too, just so you could have a liquid herb in the system. But I would need to have you getting that from the right places though. So send me a message on here and let's throw in some free stuff for you too. So, and obviously for the people on YouTube, um, even if you're international, that doesn't matter. We can all do these visits and stuff, but you can self-register on there. And when I'm doing the lives, if you text me, DM me, email me, and say your screen name, show me that you were from the live, I cut $200 off the first appointment, so it's just 99 bucks. Screaming deal. And that's after we've had an intro call. So technically 2 for 1, right? But Boki, what's going on? My son told me I have funny jokes. I bet you do. YouTube, we only have one person in here. Probably because I've been ignoring you guys. Could be why. Long time no see. I know. It's been a minute. It's been a minute. Let me just move closer. Okay. Somebody's liking this shit up like crazy. Thank you. Boo, boo, boo. My mother has cancer. Please help. I want you to send me an email because this is pretty heavy, and I would maybe even want to refer you to um, our nurse practitioner, Nicole Selesky. She only sees cancer patients, and she's done absolutely amazing things. I've seen them as well. It's just Nicole can, this is all she does. So, by far, my best resource. And if anybody in my family had it, that's probably what I would do too. You eat soap? All right. I don't know how nutrient dense that is, but I'm going to see the GI doc about my right-sided pain. What will they do? That's a good question. I don't know. It depends on how severe it is. I would imagine there will be some assessment through blood work and then some type of screening tool, whether that be ultrasound or other forms of diagnostics there too, for an imaging point of view, so that they could see morphology changes or what's happening in terms of these cells. Sunny, where are you located? I'm in New Jersey, Morris County, the Wellness Way Randolph. That's my clinic name. Ah, goodness. Recently started doing some moringa for joint pain. I've never. That sounds like a medication, right? Um, I don't know. I don't do anything with medications. Hello from India. YouTube throws me all over the world. It's kind of crazy. I've had H. pylori before. I wonder, could it be that? That wouldn't be the right side of pain. I imagine it's going to be the gallbladder. especially if it's under the ribs or near that rib area. I certainly hope it's not down by your hip. That would be more of the appendicitis route. So hopefully that's not the case. Um, but yeah, it's probably some gallbladder issues. Um, what's better, aloe vera juice or slippery elm? Yeah, I don't see any one as better than the other. It's the use case for both of them because aloe vera juice, longevity herb, um, and because of that, you're going to get a crazy amount of minerals within aloe vera juice. It's going to be very cooling for the GI. It's going to be technically a hydration or laxative effect on the colon, but also on the mouth, the esophagus. Aloe vera juice can be used as a mouthwash, and that's what I have patients do with that too. And then, in terms of being a very soothing, cooling kind of an agent for the throat, there, aloe vera juice is fantastic. Slippery elm, they're in liquid tinctures. You're gonna have to um, basically boil off some of the alcohol in there because it should be extracted through alcohol. But yeah, I might just use both. I would too. I would use both. Um, but with the liquid herbs, send me a message. We got to get you the right stuff because you're going to go and buy shit powders from Amazon and wonder why we're not getting anywhere. So let's solve the problem. Buki, I remember I told you you got CT scans and ultrasound done at the ER. Nothing was wrong. Beautiful, beautiful. What about slippery elm powder and making it like a tea? It's going to take years for you to heal this up. People don't realize when you do tea or encapsulated forms of herbs, you're getting a few minerals, maybe a couple constituents, but you're missing all the alkaloids, all the flavonoids. You get all of the minerals, you get all of the essential oils, you get everything with that plant. So I'm very much against powdered forms of those things because you're not, in terms of just a clinical result piece, yeah, tincture way better, way, way, way better. Like we're talking probably 100 times better. Can you listen to the album? No. I'm not a really big. I mean, I like music, but I don't know. I'm mainly studying, doing things like that. Are you a doc? Yes. I'm addicted to Mountain Dew. How do I cut it out? You switch to Zevia's form of Mountain Dew, which is sugar free, and boom, there you go. Can still enjoy the taste without the poison. So it's just knowing what to switch to be honest. This is all right. Good. I was gonna get the powder, so I'll get tincture instead. And yeah, it has to be um, extracted at the proper amounts. And for something like slippery elm, it's usually 3 to 6 months of extraction period. Um, so you're gonna have a hard time finding it. Um, but yeah, olive. Oh boy, it's a health Q&A. You know. Question: if I'm high on estrogen, should I be taking estradiol? Estrogen is not a hormone. It's one of nine, and you need to test all nine to know where the production or conversion issue is taking place, which is done through blood work and a urine test. And then we'll see all nine of the estrogens and their metabolites and know what to do. But if you just took more estradiol, you're going to be extremely high. So that's just one of the estrogens. Olive, dude, cringe, cringe, olive, cringe. Um, I'm experiencing cyclical sciatica with every menstruation period. Three left, three left toes, scarily losing sensation. That's a pretty aggressive response to see there. I would go to a chiropractor as soon as you can and get a workup. You get great benefit there. They did a full blood work. Um, My progesterone was low, testosterone was low, and estrogen was high. Estrogen is not a hormone. Um, so they did not do a full piece of blood work. You can't look at one marker of one estrogen and know what's going on, which is pretty crazy to hear. And again, I'm not being mean, although it sounds like I'm mean. My face sounds like I'm mean, or looks like I'm mean. My tone sounds like I'm mean. I'm not. I swear. This is for your best clinical outcomes. I want to test all of the estrogens, see where we are lacking conversion, and support those liver enzymes with either phase one or phase two metabolism. Sometimes the immune response, well, not sometimes, most of the time with the hormonal issue, there is a neurological or an immunological connection there. So, yeah, we got to look at a little bit more. But I would want to see those labs. So, for, I forget her name, Jen, send me a message on the TikTok. Melise, what's going on here? Sad face. Oh no, don't be sad. Maybe I can find them in a health food store. Those aren't going to have the right potency, purity, or concentration like in a Whole Foods. They're not going to be at the level that you need to solve the issue that you're experiencing. So send me a message. I can get you set up. We can get the right things ordered to you. Mm, ah, good to know. Yeah, that's how you solve the problem. Oh wait, what do we have? Um, cool. I don't know that med. Slightly off topic, what made you choose Cairo School? I was actually an athletic trainer working on a girl on the lacrosse team. Could not figure out for the life of me what was happening with the shoulder. And then we called in our team Cairo, and it took them like 30 seconds to fix this issue that has gone on for like 8 weeks in a row. And I was like, great, I'm missing something. So that kind of was one part of it. And then when I got to school, I started suffering with my own health issues in terms of nausea. Um, I even had forms of anemia, crazy amounts of acne, only on my back though, especially toward wheat and all of my food allergies that I had run. Seed oils, especially, made my acne and my back go crazy. I'll actually get a lot of ingrown hairs if I do mess up on my foods because we all mess up um, from time to time. But no real hormonal issue there, but my GI, the nausea, horrible bowel movements, depression, anxiety, all that came from for me it was my GI, but not everybody's the same. But yeah, good to know from Jen. Beautiful. Um, how do you know that? Ah, only your pills work? Question mark. No, they're not pills. I was talking about liquid herbs. So no pills. But nobody does it the same way in terms of manufacturing for liquid herbs. They're all selling you guys powders and giving you false hope, which is pretty unfortunate, especially on TikTok. I don't know if you can see the pink in the air. What's making me get so sassy today? Today and yesterday, I've been awfully sassy. We've been good. We've been non sassy for a little while, but yes. Used to have smoothies with milk and yogurt, sometimes cream, and it would make me worse. Yeah, do not consume dairy right now. It will wreck you, my friend, because you probably have an allergy to it. And maybe not an IgE allergy that's going to close your throat, but it certainly sounds like you got a IgG response going on, contributing to the esophagitis and all that. And that's like one of the top foods to avoid for esophagitis: eggs, food, all that stuff. Happy Bunny 14. You ignore my comment because you're not a real doctor, boy. Oh, you did put what's your actual degree? It's in my name, DC. Cool. Cool. Covered everybody. Would you look at that? And I have a ton of phone battery left, so I'm pretty happy about it. Oh no! Let's get you back up there. Cool beans. Thinking a lot of docs sell pills and stuff, but um, the only fix the symptoms, not the problems. Yes. It's more about figuring out the stressors behind creating that response in the body. And it's usually an inflammatory response, which leads you deficient, which leads you toxic in certain elements. So it's now going, okay, if everybody's like an onion, I'm not saying you guys smell, but if everybody's like an onion, you got to peel back those layers and look at food, look at the GI, look at blood work. More than just a CBC and a lipid panel that shows your cholesterol is still going up and no explanation as to why it's going up. So thank you, Shubali. Much appreciated. But yes, I wonder if I'm not gonna cut the live, but I gotta pee, so I'm gonna do that and then come back. I'm just gonna leave it rolling, to be quite honest. Um, yeah. Hopefully, you guys don't miss me too much. I will be back. I promise. I'm gonna leave now. I'll be back. All right. Hey, what's up? I'm back. Hello, random lonely microphone. Yes, just I we took a little potty break, um, but we are back in business. So, all right, how the heck are you guys doing? I know I wasn't gone for too long. Hopefully, no ghosts took over. That'd be kind of frightening, and I would have a ghost in my clinic. So, all right, Looks like we got some people chatting back and forth. It's funny. How else do I pronounce it? That's his name. I don't know. Either way, Richard, I'm blessing the lives. So, all right, you can do that, Mr. Richard. And yes, to the now no longer lonely microphone. I'm back. I'm back because if I have to pee, I usually just cut the live off. So we're just gonna keep rolling. Um, and even if the microphone battery runs out, I got a backup. So your boy came prepared today. All right. My family usually tries to find natural ways to heal. And yeah, I mean, the sorry, some people are getting filtered for no reason. So I'm going to allow those in really quick. And Kaleidoscope, that's actually a cool name. All right, where were we? For Chosen 7. Family usually tries to do some natural healing approach, which is that's awesome. Definitely the specificity helps a lot. The specificity in terms of having labs that outline, a plan of care and where your health is right now, what we need to do to get it back to normal, and then rerunning those labs and making sure everything's great for the long haul. Because the whole purpose of care is not to keep you here; it's to fix the problem and discontinue care. I certainly have some people that every year, every 2 years, year and a half, we do follow up stuff just to make sure everything's still going well and checking vitamin D, sugars, all those things. But Kaleidoscope has some questions here, I think. Let me dump all my random problems onto you that you didn't ask for. Actually, technically, I asked for them. Technically, right? So, um, I'm actually gonna. So I trust natural health docs than other ones. It's not. I actually defend them here because it's just understanding the jobs of what everybody does. And when it's involved with disease responses and you need a medication to calm something down, I mean, you ever met or experienced somebody who's going through something with their mental health? If I tell you, hey, like we can rebuild your GI, we can make all those neurotransmitters, it's just going to take 6 months. And to somebody that's suicidal right now, that they don't care about 6 months. They need something right now to just give them some time. And in that framework of time, yeah, well, if we get everything back to normal and they're feeling great, is there a need to still be on that? So, but yeah, I know what you mean. I'm just here to kind of give the full picture. I'm too stupid to live. Don't say that, man. You can do anything. Dude, if you do anything entertainment wise, I don't know how more people aren't doing this. Um, is getting to the root cause of a vestibular migraine in your scope? Well, I mean, there are certainly physical changes that can occur, whether it be orientation of the spine itself, um, even helping with the ears, drain fluid out of the eustachian tubes, and possibly impacting hearing, and through that, impacting the migraine. There can be chemical changes that are going on. Mental stress can create migraines, that's for sure. But yeah, I mean, I would I would love for you to try and see a chiro that's local to you and see where you can get in terms of that migraine relief. So I was joking, but if you want me to, I will. You certainly can. That's what we're here to do. Bum, bum, bum. Recently, small ball looking lump appeared on my inner wrist. Bony, won't go away. That is a cyst. So it will only go away with surgery. I do not perform those surgeries, so there's a way better person to ask for that in particular. But yeah, it's more than likely a cyst. A cyst. All right, we're good there. I have a good question for you. Help you get rid of my meat allergy. Yeah, that's common to see with co-infections or tick-borne illnesses. Really common. Um, Almost to the point of where it sounds kind of weird. But I would wonder if you've had Lyme in the past, or a co-infection of some sort, or you've been either on immunosuppressant things, or you're immunosuppressed. Um, and stomach acid plays a huge role there too. But the typical meat allergy is pretty aggressive. Um, but Anton, feel free to give us more. I'm getting my MRI results back tomorrow, so hooray! That is a good thing though. Assist the cyst. Sorry, it scrolled me to the bottom, and I had to read that one because it was funny. Where are we? Just my doctor just keeps saying different things instead of looking into it more. Yes, that is extremely common. It's basically everybody I ever talked to on here. What is involved? What is involved of a stomach reconstruction? I do not perform surgery. I have no idea. If I have a gaping cut and cover it, or anything will it heal on its own? I do not know the orientation or the details of the cut itself, and I would see a medical provider for that question. They will know. Do you need stitches? Do you need all these things? So, how many years of study? Gosh, 8. That's just in school. I study for 2 hours a day beyond that. So, trying to. Oh, sorry, I was getting a phone call. Actually, what time is it? Okay, cool, because this doesn't show me the time. We're getting squirrel brained. Let's dial back in here. I just made like crazy weird eye contact throughout that sip. Um, that's basically all I eat. I don't know what that was in response to. Um, okay, thanks. Helene, sorry, I just didn't know the question or the answer. I had face swelling 2 times. Okay, this is to the meat allergy. I had face swelling 2 times. My doctor said I had alpha gal antibodies and should avoid meat. Certainly true right now. How you start to get these things back? We got to check vitamin D. We got to check um, certain immune cells. I would like to see maybe an immune panel too, looking at natural killers, some of the T regulatory cells and B cells, T cells, all those things. I don't know if I said food allergy test already, but also looking for IgG and IgE food allergies because there's probably more. And a possible ELISA to look for current involved antibodies. And sometimes there's more going on. Sometimes there's some reactivation of viruses. I would want to know a little bit of vaccine history too. Sometimes people in the military, common to see them have issues with this too. So let me know if you're in the military, things like that. Um, Albizia and Nettleleaf in terms of mast cell inhibition and H2 receptor responses and getting those to calm down. I really would love you doing those too. I would also like you doing, I don't know where your vitamin D is. Some stomach acid support could help us here too, but we have to figure out the underlying pieces and buy you time as you're going through, some of the bigger things going on. But yeah, give us more details down below. And if not, send me a message. First call's free. Um, okay. How do you manage DKA? I've never heard of that in my life. Or spell it out for me. Maybe I have. We talked about those. Assist. That was funny. Why did it scroll me all the way back up here? Let's find out where we were. YouTube, I love you guys too. I see you there. I'm not ignoring anybody. um, ooh, this is nice. Somehow a free assessment. Oh, Diabetic ketoacidosis. I mean, I would want you to see a medical provider first, because this is not an area that we have a bunch of time for. Medicine is going to be able to do medications that will have your body respond. Medications change physiology. I need you guys to know that because with natural things, if you're guessing and you don't have labs associated with these things, it might change, but for a for sure way, I would want you to see a medical provider, figure out what's going on in terms of getting pathology to calm down. And then once we have some time bought, I would like to see the labs that they've ran, but also, oh, so many notifications. Also looking into um, probably a further assessment of blood work. I would want to know kidney function, some of the things going on with the liver, and probably run in some pancreatic markers too, and possible even cardiac markers. But okay, so yeah, just the abbreviation threw me off there. Getting toward the end of the day. Oh wait, I missed one. Somebody mentioned a bikini, small lump under the skin on bikini line for weeks. Not painful, anything to worry about. I would go to a provider near you. Like, go to a medical provider. Do not be afraid of medical providers. Um, Keeping health freedom in mind too. Like, you have the final decision. Just make sure it's an informed decision. And if it's life altering, please listen to the docs. Please. We can rebuild later. We need the house to stay alive. Da da da. Wow, that's a lot of words. She believed it was caused by tick bites. So yeah, Lyme. That's kind of what I was saying. Just basically immune suppression that's gone on for a very long period of time. Plus, you have probably some co-infections going on there. So maybe even some reishi mushrooms, some turkey tail. I would wonder where vitamin D's at, and doing some great anti-inflammatories like albizia, like chamomile, like nettle, just to help calm that GI and the immunological responses down. And then taking further assessments of blood work and putting the puzzle together, essentially. But yeah, okay. What do we get? Somebody over on YouTube. White monster for life. Do you like? I don't even know what that is. To be quite honest, I don't know what that is. What is One Piece? I don't know. Is there a way to help my psoriasis on my face? Again, related to the GI issue there. So with the um, issues and symptomatology going on in the throat, that is throwing off the GI, that is changing the immune response, and now your body's trying to get toxicity out of the system. And now, at that point, you're starting to express psoriasis on the skin, but that's a response toward what immunologically is going on the inside, and your body's trying to push these things out, and it can't get it out properly through phase three detoxification or the toilet, the porcelain throne. Not to be graphic with you, but yeah, there's there's connections between the GI and the other systems. So, especially the skin, really common but not normal. How do you manage congestive heart failure? Well, that is a medical question, um, because drugs manage conditions. So, how do you figure out stressors that lead toward pathology way down the road? It's figuring out where inflammatory triggers are coming from. Why is that cholesterol panel elevating? Where are the lipoprotein numbers? How do you help with circulation? And that is a case where you're going to need medical involvement. And in the meantime, there's tons that the patient can do: reducing sugar, stopping smoking, losing weight. Obviously, those are easier said than done, but now you get labs run on that patient and you know how to do those things. um, Fluid retention, big one too. I think Mineral deficiencies are extremely common. That's why a lot of people hold on to weight. And sugar's going to be your biggest battle with that. It's just over a long period of time. But yeah, that's a involved case that should be with multiple providers there. But great question, Mr. Edward. How to make connections between topics through your med student and struggle to connect physio and pathology. Um, think about it as responses. This is literally how I think about it. But my profession kind of taught me a whole different way of thinking. And pebbles themselves, like little rock pebbles, don't cause hormonal problems, right? But if you weren't allowed to take your shoes off for a day, and I threw three tiny little pebbles in your shoe, and you had to walk around on that for 8 to 10 hours, your mood's going to change, your blood pressure is going to change, your hormonal systems will respond. And those are just three little pebbles. That's a physical stress throwing off the body chemically because it's irritation and eventually creates an inflammatory response because it's a stressor. So stressors add up. There's mental, chemical, and physical ones. If you find another umbrella for another form of stress, please let me know because I've never found one yet. So, and financial stress, I would include that with mental stress. And there's a lot of that going on. Okay. But good question, though. Great questions. Great questions. And they say, okay. Hi, you look cool. Thanks. Thanks. Oh, I caught myself a little break here. Woo! We are going almost an hour and a half. Almost an hour and a half straight. Let me check. How do I check? Sorry for the earthquakes. I keep making little earthquakes here. There was a way for me to look at. Oh, okay. So we should be around 950 in terms of follower counts. So he kind of looks like RJ Mitt a little. That's a new one too. We had a couple new ones today. But either way. All right. Cool beans. I think um all these freaking phone calls. I think that's going to be it for tonight. I might jump back on here. I have a couple more patient calls to get to, and then I saw a bunch of you guys message me in here too. Then I got to check emails from YouTube as well. But for free introductory calls on TikTok, send me messages or DMs. On YouTube, you have the self registration link in my channel thing there. Just know for after that free call, if you do want to move forward, get tested, do all that stuff, you do get $200 off that initial appointment. So it's only 99 bucks from there on. But good stuff. TikTok, fantastic questions tonight. And for YouTube, you guys did pretty good too. It wasn't as crazy as yesterday, but good stuff, guys. And I'll be getting to you guys in the DM. So peace out.